Somatoform disorders are mental illnesses that cause bodily symptoms which cannot be traced back to any physical causes. The DSM-4 lists the symptoms as weakness, seizures, or abnormal movements that are not attributable to a general medical condition. The diagnosis of a somatoform disorder may be distressing to a patient because he or she can feel unsatisfied knowing that there is no tangible solution or explanation for his or her condition. This in turn creates a vicious cycle in which health anxiety further exacerbates the patient's condition. Hypochondriasis is defined as an overwhelming fear that one has a disease even though healthcare providers can find no evidence of illness. Although it was widely believed to be a stable and chronic condition with a low remission rate, studies now show that patients exhibit significant declines in symptoms yet continue to meet the DSM's diagnostic criteria over an extended time period. The causes of hypochondriasis are unknown, but statistics suggest that those with a family history of the condition, serious childhood illnesses, and recent stressful events are much more vulnerable. Conversion disorder is defined as a mental condition in which a person has blindness, paralysis, or other neurological symptoms that cannot be explained by medical intervention. According to the DSM-4 criteria, it is characterized by symptoms affecting voluntary motor or sensory function, resemblance to neurological or medical disease, involvement of psychological factors, and unintentional unfeigned symptoms. Symptoms may arise in response to a psychological conflict and usually suddenly appear following a stressful event. Due to overlapping diagnostic criteria and the overemphasis on medically unexplained symptoms, the DSM-4 term, somatoform disorders, has been replaced by somatic symptom and related disorders. This new DSM-5 term focuses on basing diagnosis on positive symptoms. Hypochondriasis has been eliminated as a disorder. Those who previously met the criteria would now most likely receive a diagnosis for somatic symptom disorder. The new diagnostic criteria requires excessive thoughts, feelings, or behaviors in addition to a persistent state of being symptomatic. The DSM-5 now defines conversion disorder as functional neurological symptom disorder. The revised criteria requires evidence of incompatibility with a neurological disease and reduces the emphasis on the psychological basis of symptoms. Thank you for listening.